Next, from Springfield, we attend a press conference led by State Senator Daniel Biss as he discusses the effects of cutting healthcare services alongside those whom rely on those services.
Good afternoon. Is everyone ready? Good afternoon. My name is Daniel Biss. I'm State Senator in the 9th District. I reside in Evanston, Illinois. And we're here today to discuss a very important public policy issue with very serious ramifications. We'll be holding in a few minutes a joint hearing of the Senate Committees on Human Services and Appropriations 1 regarding the governor and his administration's proposal around the so-called DON score, the Determination of Need score. And the proposal before us, or at least the proposal that's been talked about and that there appears to be movement on from the administration, would elevate the DON score threshold for various forms of long-term care and community programs from 29 to 37. The reason we're here today is because that description sounds awfully technical, and that description, I think, hides the very, very severe human consequences of this question. And before anybody moves forward with a proposal like this, we wanted to delve more deeply into the question of who would be affected, what does it mean, what would it allegedly help, and unfortunately, in my view, what would it harm. And to help explain that, we have a few people here with us who have been generous enough with their time to be willing to share their thoughts about this matter. Before we get there, I just wanted to make one simple point. We have made a commitment as a society to provide certain forms of care to people who require nursing home care to live in dignity in the last years of their lives, and care equally crucially, if not more crucially, to people to live in their homes or in the community in a manner that is cost-effective for the state and maximizes their own dignity and quality of life. And to take that care away from people without any clear understanding of what we're doing to people is, I think, something that is dangerous and needs to be thought about real carefully before anyone moves forward. So we're really lucky to have with us here three people. We'll hear later on from Adam Ballard, who relies on the Home Services Program. And we're going to hear now from Mary Schnell. Mary relies on the Community Care Program for day-to-day life. Mary and her husband, John, if you could please come forward and just tell us a bit about your story and explain, if you would, what these programs mean in your lives, both of your lives, and what the changes might mean for you. Thank you very much.
And could you spell Schnell?
Could I spell S-C-H-N-E-L-L?
And where do you folks live?
We live right here in Springfield. Well, I am Mary Schnell. This is my husband, John.
I'm John.
And we've been together for almost 65 years. And we're hoping we can stay together. We have a little place here in Springfield. My husband suffers from something called Lewy body dementia. And I've been his caregiver for, maybe 2.5, 3 years. And it's gotten to the point where it's a 24-hour-a-day job. I'm up a lot at night. And it's gotten to the point where I just, without help, I'm not sure I can continue to do it. My husband goes 2 days a week to a place called Addis, where they have adult daycare. It's good for him. He gets out, he mingles with people, it helps his memory. It's good for me because I get to stay home and get some rest. And then we get 4 hours a day of something called Help at Home, where a girl comes to our house and whatever we need, basically. If I need to go shopping, she'll take us shopping. If I need something done around the house, she'll help with that. And it's just been a godsend for us. Without it, I'm not sure how much longer we could manage and stay in our home. So that's where we are.
I'm a listener.
But it's okay, honey. It's okay. It's all right. I said it all. Are there any questions from anybody? Yes.
Back in 1950-ish, how did you folks meet?
we were almost neighbors. It's almost like the boy and girl next door. He lived across the field from where I lived, and we used to cut across the field all the time.
Take a shortcut.
That's really how we met each other. And we're from Wilmette. I'm from Wilmette originally. My husband is from Berwyn, moved to Wilmette. And anyhow, that's how we met. And actually, we've probably been together for maybe 67 years. We'll be married 65, but we've been together about 67.
How long have you relied on the services?
I don't think it's quite a year yet. I'm not certain, but several months.
Can you go into a little bit more detail about what service do you get from the state, and what are your concerns about the changes in the
Yeah, well, the service we get from the state is my husband goes to daycare, that's paid for by the state. He's picked up at our door, dropped off afterwards, he gets his lunch, and he does that 2 days a week, and it's for about 4 hours each time, and that the state takes care of that. Then we each get 2 hours of help at home. It's a service, again, that the state pays for to just help us. Neither one of us drive anymore. And so she'll take us to grocery shopping or doctor's appointments or anything we need around the house. We get help with that. And that's it. That's what we get.
So would you lose services under this?
Yes, I believe we would.
Yes, we would.
I believe we would, yes. And if that were to happen, like I say, I don't think I could handle it alone for very much longer because the disease gets worse, it doesn't get better.
Senator, is it your contention that if a couple like this were to lose their coverage, that the state would end up paying more money by, maybe they would have to go into a skilled nursing home?
Go ahead.
Thank you. There are two possibilities. One is that the state would have to spend more money and that the Schnells would be living a less good quality of life and the state would be paying more to harm them. The other outcome is maybe even worse, that they would have no care at all. And if that's the solution to our fiscal problems, then, man, we've made some really, really wrong decisions as a society. Taking care away from people in this situation is just not the kind of decision we ought to be making.
But Senator, it seems like, yesterday was the museum, today it was this kind of care, and nobody wants to cut anything. How are we going to get to a budget solution if everybody is so unwilling to cut anything?
We have to be willing to make hard choices, and I think we have to be honest about the fact that none of those choices will be easy or painless, but there are gradations. And I think when you talk about, oh, let's move that number, that threshold a little bit, you forget the human consequences, and I want to make sure that before any decisions are made, those human consequences are properly understood. I can't look at this presentation and say, hey, this is the right cut to make. That seems like the wrong decision to me, and I don't think it's consistent with the values of the people of Illinois. We're happy to take more questions, but Mr. Ballard also has an important story to tell, and if you don't mind, I'd like to go to him first, and then we'll have further questions if you guys are interested. Do you mind, Mr. Schnell? Is that all right?
That's fine. Sure.
Thank you. And before we get to that, I want to thank you for being here. It's very meaningful for you to join us, and we know it's not easy.
Hope so. I'll get as close as I can. Hello, can you hear me?
That works.
Okay. Hello, my name is Adam Ballard. I live in Westmont, Illinois, and I work in Chicago at Access Living, the Center for Independent Living for the City of Chicago. I am also a consumer in the state's Home Services Program, which is a program that provides personal attendant services for younger people with disabilities to be able to live independently in their homes and not in nursing homes or other congregate care settings. I've been part of the Home Services Program since I was a teenager. Can't tell you exactly how long. Probably close to 20 years. I've had these services in my life. It made it possible for me to go to college, to start a family. I have 2 beautiful boys of my own. My oldest just turned 9 last week and is already a third of the way through Lord of the Rings, so I've got my hands full. Both my sons also have disabilities, however, and because of that, it seems really unfair to me to expect more out of my family who are already helping me support my kids to also step up and provide more support for me. And if the governor's proposal goes through, that's exactly what will have to happen. My determination of need score was recently lowered in a recent reassessment, and I am now under the proposed new threshold. So if the governor's proposal goes through, I will lose all of my attendance services, which again have been part of my life and made this life possible for me for the past 15, 20 years. It's really important to understand that these services make it possible for me to get out of bed every day, to get dressed, to toileted, showered, and ready for work. Without these services, I won't be able to get to work on time because, again, my family will have to step up, and they aren't able to provide those services in the way that my professional attendants can to get me out the door and onto my train into the city on time. So my work will suffer. I could eventually lose my job, lose my home, and my family. These are all real concerns that I have if this proposal goes through and I lose these services. So I'm happy to be here with the Schnells and Senator Biss today to ask that these important services be protected by keeping the level of eligibility where it is. Thank you.
Can I ask a question, just so would you have lost your services had your determination of need score not recently been changed?
No. So prior to my last assessment, I was above the new threshold, but now I'm below it.
Mr. Ballard, what's your own, could you describe your own situation, your own disability, and that of your children that you referred to?
Yeah, so I'm a power wheelchair user. I've had this disability since I was born. It's a very rare congenital disability. I won't go into the details because it's long, but I've had it since I was born, and I've been in a wheelchair since I was in 5th grade. My oldest son is on the autism spectrum, and my youngest son has ADHD and is a cancer survivor. So that's my family.
Senator, the governor's talked about his turnaround agenda about making the state more business friendly. When I hear stories like this, and not to create any sort of campaign slogans here, but when you hear stories like this, does this kind of make you want to say that this state should be more people friendly at this point?
The governor began his term by saying that Illinois should be the most competitive and compassionate state in the union. I worry sometimes that he's forgotten about the compassion, and I think one thing that we're here to explain today is that that word compassion means a lot. And having our policies be consistent with that goal of being the most compassionate state in the union matters a lot for a lot of people who live here. And I'm committed to doing what I can to enact compassionate policies here in Illinois.
What are the estimates again that people would lose their home care if this new standard were to take effect?
I don't have that information with me, but we'll get it to you later on.
Senator, relative to the governor's reform agenda, and the Democratic Party seems to be saying that those are not part of the budget process. But the governor said the other day, I'll give you more revenue, but I want to have my agenda addressed. On the other hand, rather than pointing the finger just at the governor, would you respond, what about the governor's office would say, the Democratic leadership is as much to blame for a standoff as his office. You can't have a tug of war and complain that the other guy's pulling on the rope.
Well, I don't think we're going to get services delivered to the Schnell and Ballard households by spending a lot of time worrying about who's to blame. But what I do think is important is for us to come together and work out everything we can, understanding that the decisions will be difficult, understanding that we have divided government and that requires us to be willing to compromise in areas where there might be difficulty. Now, it seems to me that there are thousands of bills filed in the Capitol every year. There are enormous varieties of issues, and it's, I think, a little bit overly optimistic to try to solve everything in one giant grand bargain. Bruce Rauner won a gubernatorial election. He's going to be governor for 4 years. There's a lot of things he cares about. We need to work collaboratively with him on all those issues, but let's pass a budget. let's pass a budget. It's July 14th. We're into the fiscal year now. It's 2 weeks. Let's pass a budget to provide services for people who need them, to ensure that the people who provide those services get paid, to ensure the continuity of care, to ensure that people's qualities of lives aren't disrupted too much. I would assume that nobody, not me, not my Democratic colleagues in the Senate, not my Republican colleagues in the Senate, not Mike Madigan, not John Cullerton, not Bruce Rauner, nobody wants government to shut down. If that's true, we should act that way.
Well, what's stopping you? I mean, the Democrat-passed budget is $4 billion out of balance. The budget the governor proposed back in February is also out of balance. I mean, it's almost like the old joke, we'll shoot him down and let God sort it out. And what's stopping you from running a balanced budget?
I'm not sure I know that old joke. It sounds gruesome. We need to work collaboratively, and we're not going to get to a place of resolution by having programs that compete in the arena of press releases without having a real negotiation. What I would say is that among all the different issues that deserve to be negotiated and require a discussion, let's start today working collaboratively to get a budget done, because we're well overdue already and the harm is significant.
What about an override? Is there any chance of that times nearly?
I would not be surprised if we have adequate support for that in the Senate Democratic Caucus. The buzz in this building seems to be different regarding the House Democratic Caucus. Things are often different regarding the House Democratic Caucus. And I will obviously see very shortly, Amanda, since time is running out. But let's just be clear. If that's the least worst option, yikes. The Constitution of Illinois was not designed for the state to be run from the legislature. The governor has to manage the budget. If we enact a budget by overriding a veto and the governor is not willing to manage it, the outcome for the people of Illinois will be a poor outcome. So let's hope we can do better than that.
Senator, did you know on the determination of needs scores, so I don't have the numbers where they are and where the governor proposed moving it, but has anyone looked at what other states are doing on that DON score and how well it's worked out, if they are operating at a level to what the governor wants to have?
I don't know if you're working for me or something, but I'm embarrassed that I didn't answer that question in advance. It's a very important point. The DON score is a outmoded, unusual way of handling this question in the first place. And in fact, not only do other states not have it, but it's on its way out the door in Illinois as well. The administration is committed to having a new assessment model in place, in fact, by this fall. And so what we would say is, let's not make this radical change, harm a bunch of people, and then introduce a new assessment system and see where the cutoff is then. Let's say at least put this question on ice until we have that up and running, a more modern assessment system that can evaluate need in a way that's consistent with what other states do, and hopefully allow us to provide services for the people who really clearly need them in a way that's affordable for the state. I'm sorry, but we have an appropriation hearing in 0 minutes upstairs, so I'm going to have to cut this off now, but I'll be available later on today if people have follow-up questions. And once again, to the three of you, thank you very much for joining us today. It's very, very important.
Amber Smock, you're here just following a press conference. Can you share from your perspective why the determination of needs score should not be changed in Illinois at this time?
Okay, well, first of all, there's obviously the incredible impact on people with disabilities and seniors who would be immediately cut off. However, there's also the consideration that the state is already in the process of developing a tool that would assess people for home services. It's called the Universal Assessment Tool. Along with a variety of other states, Illinois is developing this tool in order to be able to better understand what services people need in their home. And the question is, why are we changing the current tool if we're already going to be going to a new tool, which is supposed to be developed by October 1st of this year?
And that new score is being determined by the federal government, or at least they're behind the initiative, is that right?
Okay, the Universal Assessment Tool is federally funded. The state is supposed to design it. Currently, the tool is in the hands of a contractor that is working to create the actual tool. The state has promised that advocates can have a look at the tool when it's complete, but we don't know what's in it. There's already been a process of more than a year where people provided public input on the tool. And so what's happened is for the state to suddenly say, let's change the Dawn score right now, it doesn't really make sense in the context of that process.
And last question, do you have any idea, well, two-part question. One, how many people receive aid now? Home, I guess, are we talking just, by the way, for clarification, are we talking just about home services?
Well, I'm here to talk not just about the home services program, but also the community care program. The home services program is for people with disabilities ages 18 to 59. That includes 30,000 people across the state of Illinois. The community care program includes seniors who are over the age of 60 who need in-home services. There's about 80,000 seniors. Altogether, the people that could be affected by changing the Dawn score is 10,000 could be affected, 1 in 3 for the home services program, and about 39,000, almost half, would be affected in the community care program.
Okay, exactly where I was going to go. And then last question, in the budget, do you know, I presume the governor's office is doing this in part to control the healthcare spending. Do you know how much we are spending currently on those services within the state?
Okay. Well, altogether, first of all, the governor's office is, I'm sorry, breaking thought. First of all, the governor's office has offered no justification for changing the Dawn score other than for budgetary concerns. It's not about people with disabilities, it's not about seniors, it's not about providing better service. Second of all, the overall cost to the state right now for both the home services program and the community care program is almost $1.5 billion. So this is not a small ticket item. The state proposed to shave $110 million off of the home services program originally, and I think a bit more for that, about maybe $150 for the community care program. They're not saving a whole lot by cutting the Dawn score. But what's going to happen is, as seniors and people with disabilities lose service, they will become more disabled and they will end up in hospitals, they will end up institutionalized. Some people will be so desperate that they will go to jail in order to get some kind of service. And all of those services cost far more than in-home services right now.
All right, thanks for joining us.
Okay.